Hello and welcome to the International Center for Journalists and to this webinar that is designed to help journalists improve their reporting on water and sanitation issues. My name is Chris Conte. I'm a journalist and have worked for many years with ICFJ. The webinar is the third in a series being produced by ICFJ in a partnership with the World Bank Strategic Impact Evaluation Fund. SIEF works around the world, primarily in low-income countries, to evaluate programs and bring evidence to bear on policy issues. ICFJ also works all around the world to support journalists in their work. Along with its partner, Code for Africa, we've launched impactAFRICA, which is a program to support pioneering data journalism that tackles development issues, initially in 6 countries: Ghana, Kenya, Nigeria, South Africa, Tanzania, and Zambia. impactAFRICA currently is accepting grant applications from journalists who report on water and sanitation issues in these 6 countries. And winners can win fully funded study trips to the United States. However, we ask that you do not ask us questions today about impactAFRICA, about its application process, eligibility, financial support, or matters like that. For that kind of information, you can visit us on the web at http://impactafrica.fund/FAQ, or you can email us at info@impactafrica.fund to get specific answers to questions you might have about the application process. These webinars are not lectures, so we urge you to send us your questions as we go. If you look around your screen, you will see an icon Q&A, and if you just click on that, you can type in a question and we will receive it. Our goal is to help potential applicants for grants and also for the contest to ask experts direct questions that will strengthen your data-driven investigative reporting and storytelling. So let's get started. I'd like to introduce our 2 distinguished guests from the World Bank. On the right side of your screen, you should see Emily Christensen Rand, who is a public health specialist and licensed civil engineer. She has a master's in public health and also a master's in business administration, plus 17 years of experience, including 8 years managing development and emergency programs in Lesotho, Sudan, Indonesia, and East Timor. Currently, she is a water supply and sanitation specialist at the World Bank, and she teaches design, implementation, and evaluation of global water, sanitation, and hygiene programs to students in the Master's in Public Health program at George Washington University. To the left of your screen is our second expert, Christian Borja-Vega. He's an economist with specializing in global water practices at the World Bank. His special skills are impact evaluation, econometrics, statistical analysis, and development operations. He has worked as a consultant at the Inter-American Development Bank, the Mexican Health Foundation, and Mexico's Secretariat of Social Development. He holds a bachelor's in economics from the Monterrey Institute of Technology and Higher Education in Mexico, and a master's in public policy from the University of Chicago. So as you can tell, we have some very interesting people with us today. And without further ado, I think we should begin. So I give the floor to Emily Christensen Rand.
Great, thank you so much for that introduction. So I'm going to be giving kind of a brief introduction, first of all, about WASH and what that means. When I say WASH, which I'll slip into that word a lot, it means water, sanitation, and hygiene. It's just an acronym for water, sanitation, and hygiene. So I'm going to talk a bit about how journalists can use data in their reporting on water and sanitation issues. I'm going to, there we go. First, I'm going to introduce the problem. So 740 48 million people lack access to improved water. If you want to get statistics for your country, you can go to the screen at the bottom there. I have wssinfo.org. They have information every year updated on each country and what those general statistics look like. But I just said improved access. What does that mean? As with many terms, that actually has a very specific definition. And rather than read this to you, I'm going to let you look at this list here that shows some improved sources and some unimproved drinking water sources. So I'll give you a moment of silence to read that. All of the images shown there are actually improved sources. But what's interesting is that that improved source doesn't necessarily mean then that what you're drinking at home is still improved water, or in fact clean, or that that water was close to your house. So actually the Sustainable Development Goals, which have just been approved, change the game a little bit. Before we were working on the Millennium Development Goals, and there we were trying to get people access to improved water. But now we have the Sustainable Development Goals. And as you can see here, it says by 2030, we'll achieve universal and equitable access to safe and affordable drinking water for all. So this adds a whole new dimension to it, safe and affordable, which there are, again, strategic definitions on. One thing you'll notice is that that actually ups the numbers, the problem, the data behind it. Now we have 1.8 billion people who are drinking fecally contaminated water. So we have a long way to go. What's still unfortunate about this all is that this new, I'm really excited about the Sustainable Development Goals, but still a water source might actually be still very far away from your home. Now, moving on from water to sanitation. There are 2.5 billion people without access to improved sanitation. Now, just like water, improved has a specific definition. So once again, I'll just give you a moment of silence so that you can look through this whole list. Now in this picture, I actually have one unimproved. The bottom left-hand picture is actually an unimproved toilet because it's not actually covered and it doesn't have a cleanable slab. Now if we move to the next slide, again, the Sustainable Development Goals are changing how we're going to be evaluating sanitation. Before, we were just trying to get people this improved sanitation, but now we're saying by 2030, we'll achieve access to adequate and equitable sanitation and hygiene for all and end open defecation, paying special attention to the needs and women and girls in those vulnerable situations. Now, I know this might sound like a whole bunch of words and blah, 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 but really, this is super exciting. We've changed from just saying, oh, we want people to have access to sanitation to actually ending open defecation. And what this means is a household having a toilet isn't enough. You actually have to use it. And just having a toilet at your house isn't enough either. You need a toilet at school and in clinics and in workplaces. So I'm super excited by these. As you can see in this next slide, 1 billion people are still open defecating. So we have a long way to go to solving this problem. And this only really counts those people who don't have a toilet. I don't know about you, but I think there are plenty of people who have a toilet in their household but still aren't using it. Now let's move to hand washing, hygiene, the last part of that WASH acronym. I rate here that 7.1 billion people are not washing their hands at all critical points each day. And that is a pretend statistic. It's not really based on any evidence or any study. But I want to ask you a question. Just think for a moment. The last time you had some papa or some fufu or maybe just a potato chip, did you wash your hands before you ate it? I think each of us can recognize, okay, maybe I'm part of that problem too. Do I always wash my hands before I eat? I want to conclude this section by sharing one slide. There was just a new study that showed that out of 66,000 facilities, over 50% did not have water, sanitation, and soap for hand washing. So I'm going to end right here for a moment, and next we'll talk about why does the problem matter. So one of the big reasons why these poor water and sanitation statistics matter is that poor water, sanitation, and hygiene kills. There are 2.4 million deaths each year that could be prevented if everyone practiced appropriate hygiene and had good, reliable sanitation and drinking water. Poor wash also causes diarrhea and a lot of other not so fun diseases. You can look here at that list and see the breakdown. Approximately 1 in 5 children under the age of 2 suffers from an episode of moderate to severe diarrhea each year. And this matters because this greatly increases their chance of death. In addition to disease and illness and death, poor wash actually causes stunting. So if you look at these pictures that I have on the screen, all 4 of these children are 7 years old. But you can see there's a big height difference. And it's not really height that matters. I myself am chronically, or vertically challenged, we should say, a little bit short. But the thing is, stunting has long-term impacts as you grow up in your education, in your professional life. It's this vicious cycle. It's not just height that's stunted, but actual brain growth. And this is what we're worried about. Christensen's going to talk a little bit more about that. Poor wash also, in addition to these factors, stunting and health and illness, costs the world. It costs the world $260 billion each year. Now, once again, I'm going to give you a moment and just answer a question in your own head. Which do you think will provide a better return on investment, water or sanitation? If you had $1, would you spend it on water or sanitation? So here we go. For every $1 spent on water, there's a $2 benefit to the community at live. And here I have a graph here that shows you some different locations. Now let's go to sanitation. For every $1 spent on sanitation, there's actually a $5.50 benefit. So I don't know about you, but that might be a little bit not what you were thinking was initially going to be the answer. So why is this? It's really important to understand the flow of disease. So I have here showing on the screen an F diagram. And if we were in a room where you could talk, I'd make you turn to your neighbor and kind of explain what in the world is this graph showing. It's showing here, this diagram shows how a toilet, do you see this toilet barrier? That makes feces not be able to reach fluids, fields, or flies. Now, safe water alone means that your water, then after you've treated your water, then it's safe and it can no longer make someone new sick. But if you look here, hygiene and hand washing actually breaks every single way that feces could get from one infected person to another infected person. So I hope you can see here that actually, safe water only stops the barrier in one way. Whereas toilet, if we contain the feces after someone poops, then we don't actually have the feces getting anywhere, and we've stopped it at its source, preventative medicine. Now you might be going, hey, you didn't tell me the return on investment in hand washing. It looks to me like hand washing might be the best thing to do. But once again, like I said, I just have to remember every time, when I last ate an apple or a banana, I didn't wash my hands first. Changing behavior on hygiene is really hard. But toilet, I don't know about you, but if I ask the greater audience, the last time you used a toilet, or the last time you defecated, did you use a toilet? Chances are, most of you looking at this through a computer are going to say yes. So, in conclusion, the real answer here is don't eat poop. So what is being done about the problem? There are lots of easy solutions. This is not rocket science. Look at these pictures. This has been done for a long time. Pit latrines, gravity-fed water systems, these are pretty easy. But sustaining those solutions is really hard. And we've discovered that there are 3 kind of components that need to happen. There needs to be demand, there needs to be supply, and an enabling environment. Now, what do those big terms mean? First of all, enabling environment means the policies and the institutions are all in place to deliver services long-term. And this is where we really need your help, the journalists out there, because this is so boring. Look at this little graph that I have here. This diagram shows you that We have capital expenditure. That's what most donors and voters want to see their money spent on. They want to see, look, I used my money and it built a new water system. But the thing is, let's be real, that money actually costs something. It costs money to operate and maintain that system, like minor maintenance, just tightening screws every once in a while. But then there's also capital maintenance. The systems sometimes break down and need real, new pipes or a new drill. And then there's expenditure direct support. People never want to talk about this, but we want an engineer in every district who can go out and help villages help refix their water, or in an urban area, this exact same thing. And then you need expenditure indirect support. We need someone sitting in the Capitol, even though that's like not something fun to write a story about, but you need those people there building the capacity of those district engineers, those district hygiene promoters, or creating policies. So that's what I talk about when I mean enabling environment. We also need the private sector and others who are willing to create and sell new enabling technologies. There are fun ways that that people are using human-centered design to really find new products that people are willing to buy. Also, as I mentioned before, having a toilet doesn't mean that everyone will use it. So we need to use a lot of programs that work on changing behaviors. And if you've ever tried to change your own behavior, you know that this is not an easy thing. So I just want to conclude right now by saying, if you want more entertaining reading about this basic background information, you could read The Big Necessity. It's a fun, really entertaining book. Or the Bill Bryson's book, At Home. He has a chapter on the toilet. And these are just fun, easy to read background stuff. But now we're going to move on, and I think Christian's going to tell us some more detailed information.
Thank you, Emily. And thank you all for listening here in this webinar. So what Emily has put up front is what are the important aspects to look at in the sector. But what I'm going to talk about is precisely how can we identify information that can be useful for us to report a story around programs that are more effective, programs that have direct effects in people's lives, in health, in practices of hygiene, in caregiving, etc. And for these, what we use typically are impact evaluations. And I will distinguish how we can look for an impact evaluation, what kind of information we can get from impact evaluations, and what is the main interpretation we can get from impact evaluations in water supply and sanitation. So the first and most important step is to really identify what's embedded in an impact evaluation against other types of study that try to relate programs aimed at improving water supply and sanitation and the outcomes that are related to people's lives and well-being. So the first one is impact evaluations are studies that provide hard evidence and a causal story between the intervention or the program itself and these outcomes. There's a causal attribution between the linkages of the presence of a program in a given community and the outcomes we observe in that community. There are other studies that, they simply collect or compile correlations. Correlations are not the same as causation. Correlation just links the presence of a program and what outcomes are there in terms of statistical associations. But it will never find the links of causal stories, of causal storylines that can really help you identify if this program is effective or not in changing people's lives. And there's also an important source of information that usually is overview, and that refers to qualitative studies. Qualitative studies provide you stories about people benefiting from these types of programs. What are their thoughts? What are their attitudes toward these programs? Do they feel that these programs are benefit them at all? This qualitative information is also very important for reporting because it can complement the quantitative storyline that you can get from statistical studies or from impact evaluations themselves. So it is very important that as a reporter, you identify these sorts of studies and plethora of information so that you can better organize a storyline where you can go from the end user to the program effects that are in place in a particular location. So in this graph, I just want you to identify and separate what is the main contribution of each type of study. Let's begin with impact evaluations. Impact evaluations are very specific studies where the main design feature of these studies is building a counterfactual, a comparison group, a comparison where we can tell the story around what is the effect of the program for people that received the program versus the people that didn't receive the program. Now, in the impact evaluation setting, what you want to do in the end is compare apples and apples, meaning that the characteristics of the people that are receiving the program has to be the same as the characteristics that are not receiving the program, so that we compare equals. And there are statistical methods and approaches in our toolbox of impact evaluations where we can build these counterfactuals statistically and compare apples and apples. If we don't take this step of building a valid counterfactual, what we will end up doing is comparing apples and pears, apples and oranges. And in the end, we can have a misleading statistic about the causal attribution of the program. So it's very important that we understand that there's a methodology behind impact evaluations to make a balance of characteristics to compare groups, where the only difference between groups is the presence of a water supply and sanitation program. There are other types of evaluation that have another type of methodology to bring more nuances and more information that is not necessarily causal information, but is statistical information or qualitative information that is also very important to analyze when we want to know the effectiveness or the effect of a program in people's life. And I mentioned to you, qualitative studies, qualitative designs help us understand what are the typical sensitivities locally that make programs work or not. How people participate or not, depending on the presence of a water supply and sanitation program. What are people looking in terms of changing their lives? Are they looking for hygiene options? Are they looking for water quality options? Each community is different, and households in those communities are very complex in terms of the relationships they have in caregiving and managing overall hygiene and sanitation. So this qualitative information embedded in qualitative design studies are very important to be reported as well. And we also have mixed methods which actually combine both qualitative approaches with quantitative approaches. And these are the most robust kind of studies that we should look at in order to understand better what is the effect of a water supply and sanitation program on the well-being of people. So I want to put you a very concrete example of how to identify a statistical study that tries to explore the effect of a program, but only using correlations, not causation. In this case, I put here a write-up from an actual program, and the summary of this program tells you how effective an antibiotic can be. And if you look closely, and I put a frame, a red frame there, it's very easy to identify if this is a statistical study versus an impact evaluation. This frame is referring to a random sample was used on 300 bacteria samples. When we have only a random sample, means that we're elaborating more on the statistical associations. When we have random assignment of a program, that's when we're trying to build a causal design, a causal story, an impact evaluation. So there's a very big distinction between a simple random sample and random assignment. And these are terms that are easy to identify in papers, in academic papers, or in technical papers, where you can say the difference between these two is that one goes to correlations and the other ones to causations. Random samples tend to analyze correlations. Random assignment of a program, in this case a WASH program, tries to analyze causation of a program. And here I want to put an example of how an impact evaluation would look like. What is the wording behind an impact evaluation? How can we read behind the lines to identify that an impact evaluation has been conducted and that we can report on that, on the effects of a program, on the effectiveness of a program? In this case, a school deworming program in Kenya, the first bullet point that you're seeing is actually identifying the problem. Hookworms infect more than 1 in 4 people worldwide. That's a global problem. But then we go to the next few slides and we start seeing a few bullets, and we start seeing that this, in this context of Kenya, contact with fecal matter, as Emily was saying, is important for the transmission of disease. And in Kenyan schools, where there's a lot of contact, kids were getting a lot of high infestation rates of hookworms. So what this impact evaluation did was to randomly assign schools into different comparison groups, one called a treatment group and one called a control group. And you can see right there, the assignment was done randomly instead of having a random sample. So we're making that big distinction there. And this distinction allows us to identify why we're looking at an impact evaluation here. So the design assigned 75 schools randomly, and then they identify between the treatment and control groups what were the difference in incidence rates between the deworming program and the incidence of worms in each study. Obviously, the deworming program was very effective because it reduced the incidence of worms in the treatment group compared to the control group. And we can say this with a lot of confidence because this design tries to identify a causal attribution. These are not simply correlations. These are causal stories where we can tell that the program actually caused that reduction in hookworm incidence. And the key to this causation story is, again, the random assignment of the comparison. And why we can have a strong causation story? Because we're comparing two groups, a treatment and control, where the only difference is the presence of the program, of the deworming program. So that's why we can establish a causal link between the program and the outcome of interest. And also, I want to make sure that you really understand how a convoluted and very academic kind of a report or paper, which typically are used in statistical studies and in impact evaluations, can confuse us very easily. For instance, I took this paragraph that summarized the results of a review of many impact evaluations, and you can see that the language is completely confusing sometimes. A full analysis of metadata, information asymmetries, complemented with iron folate supplementation and gravity. All these elements are hard to understand, and they're not made for the common person. I think the job of a reporter is to work with people that know these technicalities and then come up with a storyline that is easy to understand. So what I did here was to translate that convoluted and very complex paragraph into something simple. And as you can see, the colors of all the words there, each color is associated to the key messages that are in each of these paragraphs. So in terms of putting this into very simple terms, what we have here is a study and a review of impact evaluation studies that found that when you combine sanitation with iron supplements targeted at poor women at pregnancy, then we can see a large improvement in their nutrition. And why is it important to have an effect of iron supplements and sanitation on nutrition? Because women at pregnancy are at high risk of having complications of pregnancy if they don't have proper nutrients. So this is the example where an impact evaluation finds these effects, but we have to be very careful about translating, distilling this information to reach broader audiences. Sometimes academic studies and impact evaluations have a very narrow kind of message to portray into very specific audiences. And again, looking at and researching about what are impact evaluations saying in terms of open defecation, sanitation, and water. I just made, for the sake of this presentation, 2 quick Google searches. And in these 2 quick Google searches, we can totally get information, very fast information that we can identify if a study is a statistical study or an impact evaluation. On your left, for instance, you see the wording of water and sanitation associated with improved child growth. The keyword here is associated. It's not telling us that water and sanitation causes a reduction in improved child growth. It doesn't tell us that is rigorously linked to water and sanitation. So as you can see, I circled there the design feature of this paper, and we can see that this paper is not an impact evaluation. It's a statistical study. So in this sense, what we're finding is that the wording is very important to know what type of study we're identifying in order to report something where we can associate the program with an outcome. In your right-hand side, we can see also a storyline between open defecation and childhood stunting. And again, if you read in the abstract, well, it's very tiny there, but the point of this, reading to the abstract, you can totally tell association story, not a causal story. In this wording, the authors never explain a causal relationship between the program and childhood stunting in India. They're just explaining statistical associations. So as a reporter, again, we have to be very careful of distinguishing these types of studies. And here's an example of an impact evaluation and how we can identify if it's an impact evaluation or not by identifying keywords. So for instance, in the abstract that I put here on your right-hand side, in the impact evaluation, right away, the authors explain this is an experimental design. Whenever we have the words counterfactual, experimental design, random assignment, or any sorts or quasi-experimental designs, whenever we have these words, we have to think automatically about a causal story, okay? We cannot see just a statistical association with this wording. We're just seeing more depth of associations. We're seeing a causal story between program intervention and outcomes. And obviously, on the left-hand side, what we're seeing is how we report this, the difference between treatment and control. Because what we build in these types of studies are 2 comparable groups. We're comparing apples and apples. We only are comparing the treatment and control means because that's the effect of the program itself. It's the only difference between treatment and control is the program itself, the intervention itself, the water supply and sanitation program. So, finding stories, where to look. In terms of identifying impact evaluations, what we're still missing a lot are these blind spots. And what do I mean by that? Areas that are hard to reach or that have a very limited access to basic services such as water supply and sanitation. One of these examples is clearly in slums or in recently developed urban settings. In these settings, it's very hard that institutions that are in charge of supplying water supply and sanitation are having proper activities there, or are having systematic ways of improving service or delivering service. In this case, when we're trying to see slums, there are always blind spots of service. What the people are relying here are on informal services, or even relying on small providers. And what happens here is that we cannot know how well this service is provided or what are the quality features of these services. So there are clearly blind spots of service where impact evaluations can be very useful to identify what are the binding constraints of these areas, what are the institutional bottlenecks that doesn't allow government or WASH institutions to deliver service in these areas, or simply understanding in a qualitative basis what is the dynamic in these neighborhoods and these slums that are not allowing programs to be implemented effectively there. There's another example, and Emily talked a little bit about it. How can we relate the fact that we have a good quality of WASH services, but outside the households, outside the communities, in education facilities, for instance, or in health facilities? And this is important because in certain periods of life, some factors like poor water supply and sanitation can have real damaging consequences in terms of retaining kids in school. So poor water supply and sanitation, it has found that creates adverse environments at school. It creates poor indicators of self-efficacy, of self-esteem, and adverse attitudes towards the school itself. So if we have an inadequate facility in a school, it's very likely that kids will not be happy, will not feel confident, and therefore they will eventually drop out. And when we have a bad quality WASH service in a school, the probability of dropping out increases dramatically. And this has been studied both by statistical associations, but also by causal relationships using impact evaluations. Also, more ideas. We talk a little bit about the effects that WASH in general has on diarrhea. But when kids are exposed to, for instance, unsafe water, the recurrence of this disease and the permanent incidence of disease of these children would allow them to deteriorate the nutrition absorption capacity. And that can have devastating consequences over the long run. And a child that is getting sick more often, it will tend to be more often undernourished. And that cycle is reinforced by having poor access to water, for instance. Same with child development. Children that is exposed to fecal matter constantly will have a higher incidence of disease. And these diseases are more prevalent in critical ages. Then this can affect their cognitive and socio-emotional development. And that also has proven to have adverse consequences over the long run. So these are important associations that statistical studies, impact evaluations, and qualitative studies can help us identify the pieces of the puzzle that we need to know whenever we have a water supply and sanitation program that is working in terms of bringing better nutrition and child development outcomes. And finally, just to conclude my presentation, I want you to take a look at these links and access this information, because these links summarize in a very clear way how can we better read certain elements of information of very technical documents, statistical documents, impact evaluations, and also qualitative studies. What are the methods that are more robust compared to others? What are the outcomes that we should look for? And also, what are the main interpretations that we should give in order to build stories that can reach broader audiences? And finally, these are the list of organizations that even produce or validate statistical designs, impact evaluation designs or protocols, or qualitative studies. So I recommend also to look at these institutions, have a good search of these institutions and what have they produced, because it has very compelling information about the effectiveness of water supply and sanitation. Thank you.
So, are we back? Okay, well, thank you very much for your two presentations. Very, very interesting and a lot of information and leads for us to follow up. I want to remind our viewers and listeners that you can send us questions just by clicking on the Q&A icon on your screen. We have a few that we've collected, which I will now relay to the guests, but please keep them coming. I'd like to just start with a very general question, and it goes really to the heart of what journalists are supposed to be doing. Based on your experience and research, when you think about donor policies and what journalists are doing, what do you think is missing? What are we missing important stories?
So I'll start. Thanks for that great question. I really beg the journalists out there, we really need more stories that talk about how funding should be spent more appropriately. And it's not about construction. Those stories are so sexy. Those stories are so great to tell. Like, oh, the mayor, he wants to cut at the ceremony and it's like the ribbon and you've got this brand new thing. But the reality is that that's not what's getting long-term sustainable services to the poorest. And overwhelmingly, it is the poorest who lack services. So it's somehow about, like Christian said, going to schools and going to clinics and really finding out what government is doing and how people are changing behaviors and those smaller stories, so that donors and ultimately then policies will more focus on creating sustainable services and not new construction of new infrastructure, because that's just not what we need.
Also, I think it's very important to consider the hidden factors behind any policy or program. And what I mean by these hidden factors is, Emily touched a little bit about this. Governments tend to put a lot of joy and excitement on the hardware part, on the infrastructure part. But what about knowing what's happening on the ground? What are the social dynamics that are enabling these programs to be implemented more effective? Are communities participating? Or are just receiving these programs in a parochial way? How can we understand community participation as means to sustain services, particularly in very remote areas where the poorest are more concentrated? These are important issues because the poorest are the ones that face the highest barriers to receive service. And therefore, we need to understand why current policies and even donor money is not reaching them effectively. What are the factors that are not enabling this set of policies, programs, and spending reaching at the same level that the highest quintals of income are benefiting from. So for instance, why we see a big gap in service quality between different income cohorts when it should not be the case? That's a very important question to ask. Or why we see that many Eastern and Sub-Saharan African countries, the nutrition prevalence of their kids are practically stagnant and stable. It hasn't moved. Why that is happening, and why it's affecting more the poorest compared to non-poor?
Okay, thank you. Just to follow up a little bit on that, I'm wondering if you can talk about how priorities are set in programs to deal with these issues. And in particular, if there is a higher benefit from investment in sanitation than there is an investment in water, does our spending reflect the the higher benefits? Should we be spending more where there's a higher economic benefit?
Well, I think the first, this question has two answers for me. The first is, how can we integrate better the water supply and sanitation sectors to make this spending more effective? In many countries, including in Africa, the water institutions and the water sectors operate in a very different and discoordinated way compared to the sanitation sector. So how can we integrate these sectors more so that we can complement the programs and take advantage of economies of scale, for instance, that can reduce costs and that can make these programs better integrated in order to deliver standards of service for each component? I think that's the first part. But the second part is this a priority sector for many governments? And from all competing interventions that a government may face, for instance, ministers of finance have to really understand, where can I invest the money best, where I can reach the poorest and change their lives more effectively. And I think only recently, the water supply and sanitation sector has been putting more emphasis in cost-benefit analysis, in identifying the effectiveness of programs through impact evaluations, so that we can build a critical mass of information and knowledge where we can actually compare the effectiveness of water supply and sanitation interventions to other sectors, like health, like education, etc.
Look, WASH is great preventative medicine, and that does not make headlines. Like 20 deaths averted. Yeah, like that's not a story. So part of it is somehow, how can we make that, and how can we make that something that government is more interested in investing in, that preventative medicine? And part of it is they recently did this expenditure review in Ethiopia and found that actually only 35% of the money spent on WASH-related activities was actually from, basically the Ministry of Water or those types of, water investments. The rest, 65%, was actually spent through, local government funding and other sources like that. So it's really about working more holistically, like how can we work with health sectors and education and local governance to ensure that we're spending money not just on curing, putting a Band-Aid on a problem, but really preventative medicine from the start.
Okay, thank you. We have a couple of questions about behavior change. Diana, a friend of mine named Diana in Nigeria, in Kenya, I apologize, Diana, has asked, she sent an interesting note. She says that in Kenya, we have pit latrine projects which initially were successful at almost all homes. But that after evaluation, after a period of time, members were found to be choosing to defecate out in the open. So she wonders if there's any data around the world that explains why there is no utilization and seemingly inadequate demand.
Well, this is a very important question because, first of all, behavioral change is a critical element for the success, not only of water supply and sanitation programs, but for any programs. If you don't have participation, if people don't use the services that they're provided, then the programs will likely not be successful at all. The question is, how can we understand better the strength of social norms, of cultural values, in accessing new technologies, in accessing new service? I think this is a very nascent type of knowledge that we need to carefully craft to understand what are the nuances of what drives a person to change its cultural values and norms towards the existing use of water supply and sanitation, which typically are unimproved, versus shifting into an improved source. That is key, because the extent into which we know how deep these cultural or rooted these cultural and social norms are in any community, then we can tackle that by providing information more effectively, for instance, by doing better targeted information campaigns, by inducing behavior change through innovative approaches of community engagement or community collaboration. These are things that are worth exploring to understand what drives people of changing their behavior individually, but also collectively.
Okay, do you want me to add something too? Okay, I thought that is a great question, and I'm really glad you brought that up, because reversion rates are huge. This change behavior and then go back. But if we all just think about ourselves for a moment, I know I should exercise every day. Do I do that? It's hard. You can start a behavior and then go back. There's actually has been some really good studies. WaterAid, Plan, and UNICEF have all done some interesting work on why is it people are changing their behavior but then go back. And I would probably argue that I bet the babies in those families were often still pooping in the front yard through even when the toilet first came. And so a lot more work needs to be done on this, and it would be great if some of you would write stories about these issues and how our communities changing their behavior, what's making them decide to change, and then what's, how do they slip back? I think it's a really important story to talk more about.
And also, just to add to that, I think our audience here has to look at the World Development Report of the World Bank 2015, because it really talks about behavior change and how can we make behavior change more effective into development programs. What are the recent findings of the areas of psychology, of collective action, of economic incentives that meld together in order to achieve sustained behaviors over time, individually and collectively? So it's a great read for our audience here, the World Development Report 2015. It has a lot of information of how behavior makes a critical role in development.
Well, thank you. I would like to push you just a little bit harder on this issue, though. Mm-hmm. Christian, you mentioned blind spots, and you said one of the important blind spots is urban areas, and in particular urban slums. Mm-hmm. And I'm wondering, to what extent is behavior change really a solution to water and sanitation problems mm-hmm. in urban areas where people are so densely located that mm-hmm. it would seem to me you would need a lot of infrastructure to deal with the problem, not just a lot of hand washing.
Mm-hmm. But you need also economic policies as well. And let me put you an example of that. We have been working in Mozambique in the urban water sector because the country is facing very rapid growth in Maputo and in secondary cities. And what we have found with formative research over the last years, conducting jointly with the government, is that people were opting for using illegal sources of connectivity to the network, or even very small illegal providers of water, simply because of a cost issue. The price was lower than the price established by the formal water utility. So the strategy of the water utility was, okay, if we cannot compete with price, let's lower the price. And that has created a very strong incentive for poor households to really invest a little bit in the initial fee connection, but avoid having all the hassles of belonging into the informal market of water. And now what they're seeing by having access to the formal utility access, they're having more reliable hours of service, more consistent hours of service. The water is cleaner. The variability of the water quality is not that much compared to using informal services. So all these things are principles that are economic principles that can apply to these kind of settings. And governments have to be intelligent on first identifying the problem. A water resale and illegal connections in Mozambique was becoming a problem. So the government was pretty open and candid in identifying this problem and then trying to find very basic economic instruments or incentives to cope with the problem and to incentivize people to use more formal services. And that really has a play in urban transformations in the country. And you see that in the way of how secondary cities are having a very large increase in take-up in utility-based connections.
So one behavior change we have to talk about is a willingness on the part of citizens to pay more for better services.
Well, I would argue, actually, the poorest pay the most for water, and they're not getting it through service. They're getting it through private, especially for water. The poorest pay oftentimes at least 5 times as much, and then they're paying it for it by the jerry can, and instead of if you had a piped service delivery. So, interestingly, water is one of those subsidies that we call it's regressive. Basically, the richest are capturing most of those subsidies versus the poorest who aren't actually getting the piped service into their homes and then are using less of it if they do have it.
And here, and Emily touched a very important issue that I think more and more governments are taking in consideration, which is when you have an expansion of service or when you have new policies, what are exactly the errors of inclusion and exclusion that we're having with service? And that means how many poor that deserve a subsidy are left behind of that subsidy, and how many non-poor that should not receive a subsidy are receiving the subsidy. Those errors of inclusion and exclusion allows us to identify how effective it can be these subsidies and how we can improve the targeting of these subsidies, which is critical to level up the balance in access between the poor and the non-poor.
I have two related questions that actually follow very logically from what you've just been discussing. A questioner asked technically, I think this is an economic question, why is it, or can you explain to us how it is that inadequate water and sanitation leads to economic losses? And related to that, a broader question, why should people care about adequate services to the poor? Aside from just wanting to do right by people, is there an economic argument for improving water services and having the well-to-do maybe pay more than they do?
Well, for the first question, it's important to acknowledge that when you have services that are, let me start with the second question first. When you have people that have the same level of service and are not connecting illegally to the network, and the poor are the ones that, because they don't have options or they don't receive proper subsidies, they tend to connect more to illegal connections. Illegal connections create more leakages, and more leakages means more cost to the richest. So what you want in the end is to actually level off, access, equalize access to formal services so that you can minimize leakages and also have more precise ways of measuring water supply so that you can be more efficient in delivering the service. So those are two economic principles of equity and efficiency that apply to the justification why the poor need to have service and why it's so important to level out the balance between poor and non-poor.
Let me jump in and make it really simple here. So I get diarrhea, okay? Let's say I'm a mom of a kid. So I can't work. I have trouble. I'm not able to feed my child as well. So my child gets less food. Maybe they get sick. Maybe they don't go to school for a bunch of days while I'm not working. So we're not earning actual direct income. That would be like directly for me, some time lost. And you can imagine as that builds up over time, what kind of long-term impact that would have for a whole country. In terms of economic timeline. It's also things like tourism, like there's less tourists. So the economic costs of actually just not having access to water and sanitation for me as an individual, but also it becomes quite large when you think about the whole country.
And then there's another economic element that adds to justifying why we should care about water supply and sanitation, which is if people get recurrently sick, that creates more pressure in the health systems. Okay, so that creates extra costs to the health systems. And in the area of pensions, to illustrate this example, a lot of pension research focus on reducing non-communicable diseases, obesity. Why? Because this put a lot of pressure in pensions through increasing health costs. So by the same token, having more people sick in health services that are already strained by a lot of demand, creates an additional cost to society. And those additional costs to societies are the ones that are used to appraise the total cost to the economy, why recurrent disease from poor water supply and sanitation access leads to these higher end or macro costs to the economy as a whole through the health sector.
I just want to also put out there, so medical costs, right? If I'm sick and then I have to pay. But the other thing is also the time spent walking long distances to go collect water when I could have been engaged in other economic activities. So even when I'm healthy, I'm walking, for 2 hours a day when I could have been doing something to earn money for my kids, or if I'm a young girl, I could have been in school.
Okay, thank you. I'd like to just give you a much more focused and technical question, give you a break maybe. We're asked by a questioner from Nigeria, how does one measure water quality, and where do we get access, where can journalists get access to water quality data?
So there are two things. The first one is to look at the international standards. The WHO has international standards of water quality, and they create benchmarks of water quality in each country. The second is to look at utility information, and some utilities report water quality as well. And not in many African countries, they report water quality information, but I think in Nigeria has their own national standards that you can contrast or compare with the international WHO standards. So it's very important to recognize the international standard and also the national standard for water quality.
Also note, so there's a couple things here. Your local health office probably is doing some water testing, and it would be fascinating to just go down and see what data they have. I actually did a fascinating one. I just tested some samples from my staff once and found that 50% of those who bought water, their water was actually contaminated. And then I went to the Ministry of Health and they're like, oh yeah, of course we test that water too. We know that too. And I think that those kind of stories would just be interesting. You can even it's actually pretty simple. There's different methodologies and different, rigorousness of the different different techniques for testing water quality. But there are some that are quite easy that you could actually purchase if you wanted to, and just you add the water, shake it, and it turns brown or it doesn't. Or you can, like I said, just most I'm sure you can find someone in country, academics as well, but who have labs who are actually testing water, and get that information out there. That would be great. I'm sure that information is sitting in somebody's binder somewhere.
And finally, there are international organizations that work very closely with NGOs to collect water quality information on the ground. So UNICEF, WaterAid, WASUS, all these organizations work together with local NGOs in different contexts, but in many occasions they collect also water quality. So it will be interesting for reporting point of view to identify, what is reported in the field, what is reporting sectorally, like Emily was saying, and even what is the standard nationally and internationally. How far are communities from these standards?
I just want to clarify one thing. Is there a big difference between national standards at least in some countries, and international standards? One of our questioners actually suggested that maybe the international standard is Eurocentric for water quality.
I don't know if it's Eurocentric, because I think it considers more the standards for human consumption. But there are clearly countries that make a bigger effort to increase the bar of quality of the international standard. The international standard is a minimum requirement, right? So that you don't get sick. But there are some countries that make an effort to improve those standards for their citizens. And that's totally fine. I've seen the example of some African countries like Ghana, that they have their own national standards, and they're different from the international standards. We have to understand that the international standard is a minimum acceptable standard for human beings.
Okay, thank you. Here's another question. I'm not sure where this questioner is located because he didn't tell us, but he has an interesting question. Can you share with us experiences in communicating ideas on integrated water resources management and helping small startups with commercially viable solutions in the sanitation, water, and resource management field?
Well, I'm actually glad. I'm really glad we're getting a question about integrated IWRM. Anyways, because this is something we haven't been talking about at all. Basically, by 2030, we're going to have a demand for 40% more water than we actually have on the planet. So this is a huge issue. We need to start thinking not just about, okay, the drinking water. It's about, okay, are you using it for agriculture? Are you using it for business? And I think partially it's about not just realizing that it's not just the water we drink or even the water we bathe with, but every time you purchase something, there's this whole background of how much water it took to create that product. For example, a drinking water bottle. You want to show me your water bottle here? It's got 500 milliliters of water in it, but it actually took 6 times as much water to make the bottle itself. So we have to start thinking about the larger issue. So a reusable water bottle would take more, but the water in it, it's the water inside. Actually, I want to throw this out as well. The water inside here costs 10,000 times less than the water in the water bottle, because I just got it from a tap, so even from a public service delivery of water. But while a permanent facility would take longer, take more water to create, it then lasts longer. So these bigger questions about what we would call big water are really important to talk about. And I kind of think I went off topic a little bit and forgot about what did they want to know about the private sector? Remind me that. But I'm excited to talk about water resource management for a minute.
Okay. In general, is there an appropriate mix between public and private involvement in water and sanitation issues?
Yeah, well, and I can illustrate that with the example of Argentina. Argentina is a country that basically went from public provision to private provision. And, many academics intrigued by the effects of private provision of water supply start investigating what is the effect of this privatization of water on child mortality. And they found through a rigorous impact evaluation, having this causal story, that the effect was null. And when we talk about the participation of private sector, governments and practitioners and international organizations have to be very careful in having a good design of partnership instead of letting the whole sector be absorbed by either a private source or a public source. Water is a sector that has clear market failures, and someone has to deliver where the government cannot. And that's where the public-private partnerships are important, to fill that vacuum of market failures. And the government should be responsible of verifying that these contracts are fair, but also are in the best interest of the public, and leave a little bit of room for the private operator to have profit so that they can operate over time. And also the government has to care about equity principles when they establish long-term contracts with private operators so that nobody is left behind. There are two publications on this issue in Latin America and in Eastern and Central Asia. These books produced by the bank are very straightforward. The title is The Impact of Privatization of Infrastructure, basically. And they cover water supply, they cover electricity, they cover roads as well. And the message is, what is the overall effect? It depends. It depends on the country context. It depends on the level of participation of the private sector. But one, as a practitioner, or as a reporter that wants to inform about this, have to be really careful about knowing what are the details of these partnerships and what are the objectives of these partnerships, and if they are being implemented properly. Because when they don't implement and they're not implemented properly, you will obviously see inequities in the provision of service or unfair prices charged to the poorest.
Okay, thank you. One last reminder to our listeners, you can send in questions just by clicking the Q&A icon on your screen, but you better do it quick because you're almost out of time. And in fact, I think I'd like to ask a couple of questions that might be good points on which to conclude. First, to Emily Rand. I wonder, when you think about what research by the World Bank and other researchers has taught us in the last few years, what are the most important, exciting, interesting, significant new things that you have learned about this field yourself?
Oh, this is a great question. But I wonder how I can say the answer in a way that is exciting, because again, I guess it's kind of like these boring things. Like we have this quote, we need to fix the institutions that fix the pipes, but we don't actually fix the pipes anymore. And I think that that's an important thing that I have learned. I think that it's really nice and it's more personally rewarding to set up parallel systems and just go get the job done. But that doesn't, I'm just going to go build a tap, man. This doesn't cost that much money. I'm just going to go get rent a drill rig and put in a borehole and get these people water. But that doesn't, for the long term, it's not long and sustainable, and we need people to fix it. So I feel like my time at the World Bank, one of the big things that I've learned is that it's about institutional strengthening. And how do I say that so that it sounds exciting and sounds like something that you should go write a story about right now? But that's what it's about, institutional strengthening. And you still get to do fun capacity building and meet excellent, wonderful, amazing people. So
I think you're a little bit too defensive. It's not as boring as you seem to think. We think it is.
Convince donors and convince voters to put more of their money on that institution.
Well, and also
report how exciting things.
Also, I gather part of the goal is to convince different ministries, different institutions to work together rather than just work in their own individual silos.
Mm-hmm.
We did get a question just while you were talking. It's actually from a questioner in New York who says the following. We've talked about how to focus spending, but can we talk more about where to focus spending? Can you explain which areas, regions, countries, urban or rural areas, et cetera, would be most effective to direct our attention?
Oh, I'm so excited they're asking. I mean, I would overwhelmingly say where the poorest are. Now that's harder. How do you identify where the poorest are? And so Christian is actually working on that in a huge WASH poverty diagnostics and trying to, identify, pinpoint where are they, and those marginalized communities, those ethnic groups or people.
Overall, and this is a great question, because overall what we have seen is that governments make large advancements by focalizing investments in water supply, for instance, making the big bulk of infrastructure that is needed for this. But we have seen over and over in countries such as India, in sub-Saharan Africa, really the problem is on sanitation. Sanitation, and particularly in rural areas, has had underinvestment for years. Access to improved sources in countries like India or sub-Saharan Africa are very low, and many countries in Africa actually didn't meet the sanitation targets of the MDGs. And now that we have the Sustainable Development Goals, which are even more ambitious and require sustained use of these services, and also require a more integrated approach with resource management and water resource management, it makes a stronger case for investing heavily on sanitation. Can we focalize more spending to improve the quality of water and reduce water leakages? Yes, and that will improve efficiency of the overall systems. But I think the real challenge is for improved sanitation access to catch up with current levels of water access. So clearly the sector that is lagging behind is sanitation.
That's interesting. One of Anne's questions was about urban versus rural, where is the need greatest, or can you say?
I think that's country specific and context specific. Many countries in Africa still have a larger rural population that is predominantly poor. So, it makes sense to reach those areas first. Now, on the other hand, in terms of making provisions for the future, we know also that many African countries are growing so fast and are urbanizing so fast that we need to also consider investing in urban areas as well. The key question is, how can we make in urban areas slums more integrated to the formal access and reliable service that non-slum areas have. And in rural areas, the key question is, how can we exploit better resources, water resources, in order to make communities more resilient towards water scarcity and make services more sustained over time.
Very interesting, thank you. Just a couple more questions. I directed one kind of sweeping question to Emily, and I'd like now to direct one to Christian. Very often as experts, you're asked to tell us everything you know. I'd actually like to know what you don't know. What do you think are the most important research questions? And maybe by the same token, important questions for journalists to be asking now, things you don't know.
Well,
Christian knows everything.
Let me answer first.
To you. Yeah.
Well, one of the things that has intrigued me is how fast are countries and regions replenishing their water resources. That's, for me, that's a critical question that can be answered globally, but also at the country level. And I haven't seen such a systematic way of producing and compiling this information. What actions are societies doing to replenish this scarce resource of water? And how can we learn from successful stories where you replenish complete bodies of water, surface water or underground water? And I think that's a challenge because, again, the Sustainable Development Goals are intended for better integration with their water resource management. A lot of African countries will be water stressed in the forthcoming 20 or 30 years. There are many other areas that are becoming water stressed. So at what pace are we replenishing these resources? Just as the climate change people advocate for climate change by knowing how fast temperatures are increasing in the world and in regions, we need to know this also from the perspective of the water.
So can I assume that it would be, you would recommend that journalists start asking this question to policymakers?
That would be great, and actually I think many policymakers will not be able to answer that.
Well, let me, this has been very helpful. I've enjoyed the discussion a lot. I hope our guests have too. There is one other question that came in just here very late in our conversation, which might be a good way for us to conclude, although I think I already know Emily's answer. It's from a journalist in Croatia who says, she voices a complaint that's very common. The main problem I have as a science and environmental journalist is that editors are not very interested in topics like this. How can we change that?
He said he already knew my answer. You get to
well, if you ask me, that's a tough question. I don't know if I'm able to answer it here, but in many locations, the reliability of the source and the supply is something that changes depending on each person's perception of what is reliable for them, what is a good service for them. And I think what is important is to have performance indicators, performance benchmarks that can touch different layers of service, from the utility or the provider, but also from local governments and also from customers themselves, so that we can have all the pieces together of the puzzle, so that we can have a better perspective of what are the problems that are affecting mostly end users of these services. It varies by country to country. I guess in Croatia, they will have more capable institutions of providing service, but perhaps people have different standards or needs that are not being fulfilled. So it's important to understand what are the main thresholds or benchmarks that are covered by all the spectrum of service, from end user to the provider.
I'll chime in and try to say something a little bit different. Mm-hmm. Look, the reality is that people are moving to urban centers. And when you have people close together and they don't have water and they don't have sanitation, disease is going to explode. There will be more Ebola type things. And that's sexy enough to make the news. So I think that talking now, preparing now, what is it that we can honestly do? It's partially our consumption levels, like my consumption, that is creating some of these problems. And so drawing those lines perhaps for people, because people love like big splashy stories. So somehow, how can you help people realize that their actions today are actually going to lead to longer term, more migration, these kind of things, because of the way we're abusing water right now?
And remember, it's very simple phrase to make the storyline and the headline. You know, without water, you don't live.
Yeah, it's it's so common we take it for granted, but part of our job as journalists is to say we should not take it for granted anymore.
Yeah.
Okay. Well, thank you both very much, Emily Christensen Rand and Christian Borja-Vega. It's been very, very interesting and informative, and we so appreciate your sharing with us. This webinar will be available online, and so the millions of people who missed it today will have another chance, and I hope at least several million do take advantage of that. But for now, thank you very much, and good day.
Thank you.
Thank you.